the Prophets. So we'll get to that soon. But first, the start of the show, inshallah, we'll get to you now. Qavi bhai, the legend of Walsall and legend of Midlands. We go way back, mainly during football days. I always just remember seeing you guys, seeing your goatee and knowing this guy, this guy plays well. So that was my first introduction to you. But you can tell us much more. Just the whole purpose of Khuddam, as you know, is just to get to know what each other do. Everyone does some sort of work, so it's good to know what each other's lives are like and what you go through day to day, and how your life has impacted you with the Jamaat and how the Jamaat's impacted yourself in your work life. So, Qavi Sahab, Assalamu alaikum. Jazakallah for coming on. You came on last week as well, but you have the mic today.
Yes, yeah. No, I'm not really prepared anything as such, so I'll be led by you and any questions anybody has.
Yeah.
But yeah, it's good to be online with everybody.
Jazakallah.
We can't be in person. Yeah, so just a bit about myself. Most people will probably know who I am. A few people probably won't. So yeah, my name's Qavi. I was born in Birmingham. So my childhood was in Kings Heath area of Birmingham. We lived there since I was about 10, up till I was about 10 or 11, and then we moved to Walsall. Grew up in Walsall mostly. And yeah, just it was taking 2 buses for 7 years to school in Birmingham. Went to the same school as Nas. He's in there somewhere, I think, in Sutton Coldfield.
He's hiding there, yeah.
Yeah. Before that, in terms of history, my Dada Jan was the one who came here first in 1962 by ship, which took a month to get here, and then yeah, the rest is history.
So how did you, after going through school, how did you decide? I know you're going to tell us what you do now, but how did you eventually get onto that route of? Was it just you going with the flow, just whatever studies you were doing, you enjoyed it and you were doing it, or was it like really wanted to do it?
In terms of studies, I didn't really know what I was doing. Maybe a lot of people can relate to that. Some people argue I still don't know what I'm doing. But yeah, I mean, I knew that I wanted to do something science related. And with us, although medicine was encouraged in all Asian families as it is, but I don't know, I was put off by it for quite a lot of time, probably owing to one of our uncles who used to discourage us and give us some funny stories. But then later on, I did realize that actually it is a good field, so anyone thinking about it should definitely seriously consider it. And by the time that came, I think it was a bit too late for me in terms of where I was personally, family situation as well. But I always knew I wanted to do something in science. Yeah, and then when I was actually studying as well, in microbiology in particular. So yeah.
So just before we get into the build-up of your actual work, what you do, I always like discussing the Jamaat side of it, because most of us, before we get into work, we've already got like a good bunch of experience before going into work. So what did you learn from your roles in the Jamaat? What roles in the Jamaat did you have that actually helped you with your work?
Well, I was lucky to serve as guide for quite a few years.
Yeah.
And really, it really did. I don't know, you can't really put into words how it helped, but it helped in every aspect of your life, I would say, in so many ways, because there's so many transferable skills which can relate to your actual working life as well. Apart from that, you can put all your stuff in your applications, all the humanitarian work that we do, the blood donation, or even the communication aspect of it, or even all of this all counts as well, because this is all transferable skills, or writing emails, calls, spoken, written, listening skills even as well. It all comes into it.
Yeah.
Yeah. I mean, what do you think? Have I missed something? There's
Yeah,
probably more.
being guide, of course, that's the pinnacle, I think, for any khadim. I think that's when you really learn how to manage things,
Time management, yeah,
how
absolutely.
to, yeah, exactly. You have to manage your work and your Jamaat work. When you don't have a big responsibility in Jamaat, you give more time to your work. But when you have that Jamaat work, I think you're more disciplined in knowing that, okay, I have to get these things done. So you just make time for it naturally. And of
Yeah,
course, as a family man as well, you'll know how difficult that is, but you just
yeah,
have to get into that. But we'll get there. But so we've talked about your Jamaat, we've talked about you've gone to work. So what's your actual title, and what's like your day to day job, day to day routine?
yeah. Yeah, before that, actually, I would say for me, it's a long road. It was a yeah. It took quite some time for me to get to where I am, because at the time when I graduated, there wasn't many positions what I was going for. So I was basically helping out my dad and volunteering with his businesses mostly until I got an opportunity to get my foot in. So I started off as a medical lab assistant
Okay.
part time at New Cross Hospital in Wolverhampton. I did that for about 3 years or so. And then I got some opportunity to progress internally there, which I did. And then that's when I went, after a few years, I went to Devon for my trainee year.
Hmm.
So I didn't do my placement year at university, which maybe I should have. So I went to Devon to do my trainee year, and then not my trainee year, to do my trainee position. And then a few years there after doing that, I've come back now. So yeah, so my title is a specialist biomedical scientist. It's a big word, but all it is, it just means that I'm just working in the lab, and we receive patient samples and specimens which we perform analyses and tests on
Hmm.
in order to find and isolate the cause of infection and illness.
Okay.
So yeah, you can imagine me trying to tell my mom what I do.
So that's quite we can relate to that nowadays, especially with the coronavirus. And I know life was probably a bit different before all this panic started. Well, how's life now? Of course, we've gone through so much of it. We're almost used to it now. We're almost used to everyone wearing the mask. So we're all essentially living like a doctor in a way. But how in terms of uniform and everything? But how's life changed in your workplace?
So yeah, so when we're in the lab working, we have to wear personal protective equipment (PPE) as it is anyway.
Hmm.
So for us, that consists of like a lab coat and gloves and safety specs where indicated. Besides that, there's a specialist room, which is called a containment level 3 room, where we process respiratory samples.
Hmm.
Because with respiratory samples, the risk is aerosols and breathing that in, which exposes you to whatever you're dealing with or manipulating with at the time. So traditionally, it's mostly been TB work. So any sputum sample or bronchial washing samples or cough swabs for cystic fibrosis patients, things like that, they'll get processed underneath a cabinet. It's called a class 1 safety cabinet. So everything goes through it's called a HEPA filter, which kills all particles. And there's negative airflow suction, so no air comes back at you, so that there's no risk of you breathing it in. So that's where these COVID samples are processed as
Hmm.
well, when we are doing them as well. Sorry, your question was how
Yeah.
have things changed? So basically, as we all know, GP surgeries have mostly been closing, although they are starting to. I think some places are starting to reopen. I'm not sure what the case
Hmm.
is with GPs still. I think it's still closed actually. So our routine workload has become less, but the other side with all these COVID swabs, that's coming now in its place, and we've had to reshuffle and reprioritize what we're testing.
Yeah.
So for us, the most important samples in microbiology is your sterile fluids and blood cultures.
Hmm.
So when you hear about meningitis, so there's a CSF sample which comes to us as soon as possible. So it's important that we look at that. That's still going. Nothing's changed there. Blood culture samples. So you might have heard in the press and media sepsis as well. So we still look at that urgently. Alongside that, then it's these COVID samples and all this government response, which is initiated. So we've been a big part of that in terms of testing capacity in the labs, which you're probably hearing in the news every day as well. So a lot of the work is referred as well. And we're actually testing in-house the most urgent patient samples. A lot of the work is referred to New Cross Hospital because our lab is going to be joining with New Cross Hospital. It's going to be a hub there. So in the NHS, there's a lot of cost saving and cost cutting going on. So they're initiating this hub and spoke model of labs. So already we've started transitioning there, and there's going to be a lot of samples going over there as well. So we're referring a lot of work that way as well. The urgent swabs and samples we are testing in-house. Mostly that's how it's changed.
That's crazy.
Yeah.
So just linking to that, just last week, 2 weeks ago, we spoke to Dr. Hisham, and we spoke about how this impacted his family life. And I know you have, mashallah, you have 2 kids as well. And you coming from work, you have to take precautions. And there's a high risk, especially you coming from a lab, you testing all these different viruses and infections. How did that affect you? And initially, how did you, first when you thought about it and you saw like in the news that you can't have contact with your kids and stuff, how did that initially affect you? And how did you manage it, and how are you dealing with it now?
Yeah, initially my dadi called and said, "Qavi, kaam par nahi jana, chhod do." She said, "Leave work. You shouldn't go there." So obviously I couldn't do that. But yeah, it is still shocking, really, if you think about what's happened within a matter of few months. Like the whole country shut down, and the effect is happening. It's like once in a generation. The last pandemic comparable was in 1918, the Spanish flu that happened. So it is. It's just it's just shocking even now. Just when you think about it, it is. And trying to explain to everyone to take it seriously, and it seems surreal. Often when you look at it in the news, you think that it can't reach you. Sometimes I think some people think that way, but it's just getting across the importance of the instructions of the government and what Hazura said. Obviously, to comply with those instructions, because it really, we don't know what effect it can have to whom, because as we've seen, healthy individuals have been affected by it as well. So yeah, for me, obviously for healthcare staff, NHS staff, whether you're on the front line or even if you're not, you're at increased risk. And at the same time, I should say as well, care staff as well, care home staff in that field as well, they are at increased risk as well. So what I've been doing is when I'm getting back, I'm not as much as risk as the frontline staff, as the doctors and nurses, porters, because they're directly involved with patients. So my field is more with obviously the samples, as I've explained. But still, those samples, if you think about it, they're coming from different parts of the hospital, from sick patients, from those doctors and nurses and porters who are transporting those samples. So in the process, it could have been the case that these samples have been into contact with 5-6 different people, so it could be carrying all sorts of things. So we still need to take our precautions still. So what I've been doing is I've been, as soon as I'm home, I'm going straight up into the shower, changing clothes, going straight into the wash. Obviously hand hygiene is really important. Washing hands many times. Same as everyone else, trying not to touch anything. And then once I've done that, then I'm good to go. The rest is all, you just pray. But yeah.
Even the kids, they have to you have to wait for them.
So yeah, with the families or with the kids, when I get back from work, the kids are running to me. I'm like, no, and they're all confused. They're too young to understand what's going on. So it is difficult. Apart from that as well, I've made arrangements. So we're quite lucky that we can make arrangements with the trust where I work. for them to have a hotel room ready in case I do begin to develop symptoms. So
Yeah.
if I begin to develop symptoms, or if I'm not feeling too well after work, I'll just go straight there. And they've provided that, they've taken care of that, so that's a good thing. So I'll be able to self-isolate in that respect as well.
Mashallah.
But yeah, even thinking of that, that would be hard as well. But it's something which, yeah, will need to be done.
Yeah. Yeah, Jazakallah. If anyone has any questions, you can please just get them ready. Just start asking them as we're talking. But for me personally, I just find it really interesting, especially because we're always hearing in the news, NHS are doing an amazing job, and clap for NHS and all those things. I'm sure people have probably been telling you as well, maybe because maybe some of you wear badges and things like that, so people will recognize straight away that you're working for the NHS.
Yeah,
I know
actually,
that.
with our field, it's more behind the scenes. So no one ever hears of biomedical scientists. It's always doctors and nurses
Yeah.
and that. But with this pandemic, it has actually brought it more into the limelight. Because, I mean, the chief executive of the IBMS, which is one of the organizations which represents us, he's been giving interviews up and down the country as well. And all this testing malarkey that's been going on with test targets not being met and whatnot. So it has brought a bit more to the front what our work is.
Yeah, so it's good we're talking about it then, isn't it? So good to highlight you guys as well, just as we should. And this is exactly what the opportunity brings when we have Khuddam. Like, we give voice to those people who you don't really hear about, and they're working, but we don't actually know what you're actually doing. So it's really nice to hear your side of the story. And it's really good
If
to
anyone
share.
wants some more information, I'm available on a private call as well. If anyone wants to know in more detail, and
exactly.
anyone's got any questions.
Has anyone got any questions? Zaid, you got any questions for Qavi?
Yeah, I've got a question.
Nuri
When
as
you were
well.
mentioning about you were mentioning about the different other samples that you also deal with apart from COVID at the moment, which is normally what you face. Which you normally deal with in your normal time, apart from when this COVID was. What is like, just to understand, like, a bit more about what you do as well, and a bit more about the lab. The samples. What is the difference between the ones that you normally do and the ones that I think you said that you prioritize them first, or you're doing them first and then?
Yeah, sorry, I probably didn't make myself very clear. So the fluid samples which I mentioned were like your CSF samples and blood culture samples. So there's different parts or sections of the lab. So it's split. So there's like the urine bench, there's enteric bench, which is your fecal analysis, poo samples. Someone's got to find out all the source of this diarrhea. UTI, urinary tract infections, respiratory infections, normal respiratory infections, TB, which is caused by mycobacteria. And then there's other serology aspects which come into it in terms of looking for, rather than growing the organism, looking for the body's antigen or antibody response in order to diagnose infection and see if you're immune to it. So a lot of the work is split into sections. The priority, like I mentioned, are those samples. So, I don't know how much detail you're asking, Zaid Saab.
No, it's just that due to this, obviously, like now everyone's like kind of like COVID at the moment, isn't it? And it's all COVID. The other things that you normally do, are they still the priority still there, or are they much more higher priority than COVID anyway?
So no, they are probably more of a priority in many cases, because sepsis will kill you much faster than COVID will. So by sepsis, I mean like blood poisoning, you might have heard in the media. So if you've got bacteria running through your bloodstream, so what we'll do is the blood is taken from the patient at the bedside by your nurses or doctors, and it's transported to us as soon as possible. I'm just giving you an example now. It's loaded onto a blood culture machine. It's essentially like an oven, you can say, but we call it an incubator. and it goes through automated monitoring, and it measures various parameters. It actually measures. It's very clever technology which it uses. So it measures like CO2 production of bacteria. It shows that they're respiring, and once it reaches a certain level, it will flag on the machine. So we'll take that off when it flags. We'll make like a gram film of that. It's something called a gram stain, which some people might have studied. So that's a specialized technique where we stain to look for bacteria, and we can tell, and then we look at that under the microscope, and then we can tell what that means, what shape it is, whether it's gram positive or gram negative. And even just by that information, that's very helpful to the doctors. They can start treating the patients. Apart from that, we put some blood onto culture media, onto agar, where we grow those organisms. So traditionally that takes 24 hours. So the next day we'll come in and look at the plates, and then we'll ID what's growing, and then we can have a definitive answer as to what it is. So for blood cultures, that's very important. For CSF samples, cerebrospinal fluid samples for query meningitis, that's very important. We have to come out anytime during the night or day for that, so we can get called out in silly times in the night for that. So the reason for that is so we will have to look for white cells in the actual sample. So a raised white cell count, and then the type of white cells there are will give you an idea as to what kind of infection it can be. But yeah, so it's on a par with the COVID samples as well, because so essentially if everything shut down, it would be the sterile fluids bench and the COVID samples which would be processing, and everything else can wait. So UTIs can wait. You're not going to die from that immediately. And other benches can be shut down. So that's what we were doing. We are reprioritizing with our staffing. Does that make sense?
Yeah, Jazakallah.
G.
Sorry, has anyone else got any questions?
I've got one. Go ahead. How many samples do you do in a day, like for COVID?
Yeah, so like I mentioned, it's at the moment it's around 100 samples or so, which we are receiving. Out of those, we've got an allocation actually as to the most urgent samples, which we will do in-house. So by urgent, I mean we can have a result within an hour. We can have a result within an hour, so we can say whether somebody has coronavirus. So it's actually it's a PCR test, which can give you a rapid result. So you're basically looking for the coronavirus genome. Which you can look into if you're interested in that. You can do a Google search. It's quite interesting how that works. So 100 samples or so. In the peak a few weeks ago, we had up to 600. So you can imagine the workload that was. We were basically using different cabinets all over the lab, and we shut down most things, and everyone was getting involved trying to get these samples out and processed and tested in-house, the ones which needed testing. So it was a massive impact and change to normality. But right now it's calmed down a little bit. But depending on what the government strategy will be going forward, we'll see what happens to that. Yeah.
Any other questions? Just one question from me, last question. For anyone who's going into biomed, would you have any advice for them in preparation for that?
I'm not sure what the requirements are right now in terms of university, but yeah, I think you need science subjects and maths. So there's different disciplines which you can go into. So I've chosen microbiology, that's my specialty, but there's blood sciences, there's chemistry, there's histopathology as well. But it's quite good. I'm still learning as well. I'm enjoying at the moment. So you'll need to do a registration portfolio, which you can either choose to do as part of your university. You can choose that as part of your university placement year, or you can do what I did, which was a long-winded way to do it afterwards. Do a trainee position, and then do it that way, and that enables you to get registered with the HCPC, which is the Health and Care Professions Council. And then the good thing is, well, for me, I enjoy it. It's lifelong learning, so it's called CPD, continual professional development. You have to always be doing something to be putting into that folder and progressing. And then you have a master's for a senior post as well. And then you can either go down a managerial route, or you can start locuming, or you can completely change. You can start going into sales that way, or there's a bit of a transition into clinical scientist, which is a lot more patient focused as well, which I think, inshallah, with experience, I look to try to go into as well. So there's lots of opportunities there. Yeah.
Guys, so we're just talking about Qavi's career, and alhamdulillah, it's been a very good talk so far. We're just going through the questions now. Everyone's asking questions. I think we just had our last question.
Sorry, I'm sorry I'm late. You look very festive. Not gonna lie. Qavi, Mum, if you don't... Mum turning lights off. Thanks, Mum. Qavi, I'm so sorry I come on late, man. I was got caught up, and then I've just only got 3, but can you briefly go through it again? Just in a nutshell, so I can just jog my memory.
Sorry, what was that?
Sorry, if you don't
can you sum up your life in a nutshell?
My life in a nutshell.
Sorry.
Yeah, so I was just talking about what I was doing recently, what's been going on, and we were just talking about the COVID samples and how that's affected the laboratory prioritization and what it is. So I was just saying that we're getting close to 100 samples a day at the moment in City Hospital. At its peak, we had about 500 to 600 samples.
Wow.
So the most urgent we're testing in-house. So by that, that means that we can have a result within the hour. A lot of the samples we're referring, and because we're part of this group called the BCPS, which means that there's going to be a lab merger. So the lab at New Cross Hospital, which we're going to be joining with, well, it was meant to be towards the end of this year. It might be somewhat delayed now, but we're referring samples over there as well. Actually, you might have heard in the news, there's been a shortage of reagents.
Okay.
So that's actually affected us as well now. So we've stopped sending a lot of the samples to New Cross, and we're sending it to a private lab, I think, which is a lab which has been set up. Maybe it's for this purpose. So a lot of the samples are going to Nottingham as well now, because of this reagent issue. So they're using a different testing platform, which doesn't use those reagents, which is why we can send it over there.
Yeah.
So yeah, I was just talking about.
The antibody test got thingy yesterday, didn't it?
Yes, yeah, that's a good
the latest, isn't it? Yeah. Because even at our work, they've said that we can be tested now, but at that point, it was only the antigen test. But now with the antibody test, there's no getting away with it, is it? If you
yeah, that's what I've been saying. I want to be the first one to have the antibody test, as I want to know if I've had it.
But do you know that antibody test? I heard it's also, again, please correct me if I'm wrong. I don't know if you know, but it's only for like a month or so, and then you can still get the disease, the COVID.
So yeah, that's what they're saying. They're not sure if how long immunity lasts anyway. So whether it's useful or not, that's still up for discussion.
Yeah.
But in theory, that's what they're saying. So what it is, there's an antigen test and an antibody test. So if you've got the antibodies, that means you've had the virus. So you should, in theory, have some sort of immunity. But yeah, we don't know whether it lasts or not. I think there's long-term studies going on, and there'll probably be some coming out from China. What the case is.
Vaccine, we're probably looking at over a year or so, aren't we?
That's what they're saying, but there might be something fast-tracked towards the end of this year. Who knows?
Okay, fine.
Yeah, probably to mass produce it. That's the other issue, isn't it?
Yeah.
To be available to a mass population, probably talking next year.
It's mad, man. Honestly, one virus is.
There was a video on Instagram someone from the future in 2024. He came back to 2020 and asked himself, "What year are you in?" And he said 2020. He's, "Oh, you're just going through the 4-year coronavirus." He's like, "What?" But you never know how long it's gonna last. It's just,
Yeah, that's the other thing. We don't know how long it's gonna be around. So I think these changes that have been introduced, they're gonna be around for some time. And even if our Prime Minister Bojo says everything back to normal, obviously we should still go with caution and take into consideration what's been said already in terms of social distancing.
Yeah.
And what Hazura said with all the remedies and instructions which have been given, we should still be very careful. Yeah.
Salman, I think you had a question. Let's go to Salman quickly because he put his hand up like a good boy.
Salman's video's not on. Okay, fine.
Salman, are you there? That was accident.
This Warsaw Salman.
Yeah, of course it is.
That's like when the teacher asks you a question. I didn't mean it.
I was just stretching.
Salman smashed it.
Okay. Is that all right then? Yeah, guys, have any more questions or are you good?
No, I think with Qavi, I know it's he went away for a while, didn't he? And then now Alhamdulillah he's back. So
so I briefly mentioned. I didn't go into too much detail.
Yeah.
So obviously,
I'm just happy you're back, man. Alhamdulillah. So it's good to see you back, man.
It is good to be back. It is good to be back. It is a different life in Devon. It's really good. It was good to have a break as well. But it's really beautiful area, southwest coast path. I'd recommend everyone to go around there.
You lot all had a trip once and didn't tell me in that. So.
Yeah, the Khuddam trip. The lads came in and stayed at.
How you organised that one and didn't tell me until on the day? I think.
He was saying something there, wasn't
he? Yeah, he's listening.
Yeah, no, that was a really good time. We had a nice barbecue as well. Should arrange something like that again once
this all settles down. Yeah, inshallah.
Inshallah. Tiga. Jazakallah. Thank you so much.